Yeah, go for it.
So I'm Jacques van Straten. I am the founder and director of Ranger Guardians nonprofits. I'm also a full-time ranger. I've been in anti-poaching now for about 4, going on to 5 years. I think it's more closer to 5 years. Yeah, that's me.
Okay. I'm Ferdi. Been a ranger since '09. Been teaching since about 2012. Um, and now this is kind of what we do full time, other than security contracting overseas. I teach, and one of the founders and co-directors of Meercat Solutions, where we teach wilderness and anti-poaching skills and medical skills to guys from all over the world.
Yeah,
So
yeah.
so
Uh, I promise. I promise. I'm going to try not to swear.
and
Not guaranteeing anything.
I downloaded DaVinci Resolve, so we'll bleep it out as best we can.
I'll get my guy to use the what did he use with us? He used the what's that annoying bird?
Uh,
Um
yeah.
the
I mean that those two episodes came out pretty well, though, I think. Um,
I think so too. I think the only reason why it didn't gain so much traction is because of our topic. I think our topic is very specific.
yeah,
Um,
yeah.
but I think as we start to create more content, I feel that those episodes are going to gain traction.
Yeah.
Because a friend of mine who's got nothing to do with anti-poaching, knows nothing about anti-poaching or the medical field,
Yeah.
he actually found it very interesting.
Oh,
And that's the type of response that we want.
yeah.
We want that response from an average Joe who knows nothing about that to listen to that and walk away with something.
Yeah. Yeah.
So I think that's how we also attract people to what we're doing and attract people to get involved with donating and etc. etc. etc.
Yeah, I mean, talking about it as we see it, not trying to glorify it, um, and kind of create a realistic a realistic image of what's happening, and
Yeah.
what we can expect from it. I think that's maybe the best way to go about it.
Yes.
So
Agreed. Yeah.
yeah,
Cool.
I
So I mean,
sorry,
yeah.
Karen.
No, you go.
No, I think maybe another cool topic for us to talk about at some stage, and is now what's going on in the Congo, and how that might affect parks like Virunga. Um,
Yes.
because I would love to dive into that with someone someday. Because I mean, Virunga is one of my bucket list parks that I still want to visit. Um,
Yeah.
so I would love to chat about how that is being affected by what's going on there. So
Agreed. I mean, for me, any parks outside of South Africa, because as you know, I haven't had a chance to work outside of South Africa yet.
yeah,
But I would love to experience. I mean, I know just working with the gorillas, for example.
mm,
Anti-poaching in terms of looking after those gorillas. I know that's a completely different level to what anti-poaching is in South Africa.
yeah,
I mean, to a certain extent, you're actually you're fighting a war. It's not anti-poaching. I
yeah.
mean, when you call yourself an anti-poaching unit, but you're getting strapped with RPGs. I'm sorry, but
This is a conversation we'll touch on it during the course discussion, that I
yeah,
had with some of the US guys that was attending. If you look at a poaching patrol profile from the DRC and from Central African Republic, I mean those guys are you're looking like 8 to 10 guys with AKs, belt feds, and RPGs, and that's the Rangers. Um,
yeah, exactly,
it's a different ball game to what we face with. You've got two, maybe three guys on a patrol, with normal semi-auto rifles. Like, I mean, the risk profile is completely different up there.
exactly,
Yeah.
exactly, exactly.
But
Yeah,
yeah. Um, so you want to try? Should we try and kick this off?
Yes. So then, yeah. So then, I'm just going to start off then. So tell me about how things started to develop before the course started. Tell me what it was like about, going through the motions of getting the material together, and putting the course content together.
Yeah. So the like Putin said, we have to start back right in the beginning. Um, so like I said, I've been teaching Rangers for quite a while now, and I mean when and this is the discussion we had about what was the equipment being issued to guys, and uh, especially on the first aid side.
Yeah.
And I remember we got a little hiking first aid pack that Outdoor Wearer sold, and it had like a couple of boo-boo bandages and whatever in it. Um,
Yeah.
and that's where I got introduced to my first TAC med or TCCC style course that was taught by an ex or he was then still very much active task force medic. And it completely changed my mind, and we started incorporating that into our training. Um,
Yeah.
and it's only I want to say in the last 6 or 7 years in South Africa where it's actually started taking off and started gaining traction, and guys realize that there's a specific uh, training that these guys need, and your generic first aid is not going to work. Um,
Yeah.
and I was very, very fortunate to kind of see that shift happen while I was still active, very much active in APU in the area that you're in, and that's where we saw
Yeah.
the the most amount of injuries and contacts were in your area,
Yeah.
and that's where we saw the massive shift happen towards okay, maybe being more tactically orientated on our medical skills is not a bad idea. Guys were
Yes.
spending a lot of money on uh, tactical training, weapons training, uh, but nobody spent money on med, and that started
Yes.
changing about 7 or 8 years ago. Where we are today now, where it's actually a common and accepted practice for guys to do that.
Yeah.
Um, and so everybody's doing stop the bleed. Everybody is getting kind of a care under fire, if I can use that term very loosely, um,
Yes.
style of training. Pack the wound, tourniquet, and that's it. Um,
Yes.
and we kind of said, okay, there is some steps after that. I was very fortunate. Um, I was a medic already in that environment, so I kind of knew what is the steps that's supposed to follow that.
Yeah.
And I wanted to kind of give that over, kind of transfer that knowledge. Um, and the US guys have got a very nice escalation with kind of the all service members, then combat lifesaver, then combat medic, and then advanced provider. Um, and with the new curriculum on first aid, we kind of saw our opportunity. Okay, this might be it. So this program that the guys attended is that evolution. It's not a
Yeah.
it's not a tactical program. It's a medical program with tactical elements,
Yes.
and it teaches you that section where it starts tactical field care uh, to evacuation care. You know that second and
Yeah.
third section
Yes.
of it.
Yeah.
On the TECC side, they'll talk about the indirect threat and then the evacuation care. Um,
Yes.
this is where this program is aimed at. So for the guys to
Okay.
attend, for the guys to attend, they have to have that basic understanding of how to apply tourniquets, how to wound pack, how to
Yeah.
do CPR. Like that basic level knowledge needs to be in
Yeah.
place. This is that
Yeah.
evolution from that. Yeah,
Okay. Okay.
yeah.
And how was it putting it together? That's why. So the motions going through everything and the course content. What were did you find yourself because this was the first time putting this stuff together? Did
Yeah,
you find yourself doubting yourself about how you were putting the content together?
yeah. I mean, like the basis of the material is is actually this little manual here. I don't know
Yep.
if you guys can see that. Uh,
Yeah, I can
yeah.
see it. Yeah,
So the basis is on the new providing first aid as an advanced first responder. So that was the
yeah.
basis on the medical stuff. So a lot of that I did not have to dream up or think. It was already in place. Um, what we then did is we kind of looked at the TCCC recommendations or the TCCC protocols,
Yeah.
and the TECC, the Tactical Emergency Casualty Care recommendation for active bystanders and bystanders with a responsibility or responsibility to react or something like, I can't remember the exact term.
Yeah.
And we incorporated that into this.
Okay.
So
Okay.
um, we kind of had to redevelop the didactic and as well as how the course flows to
Yeah.
incorporate, because obviously the normal first aid stuff is aimed at civilians. Um,
Yeah.
uh, Now, technically, I know private security civilians as well, but um, for the guys in the field, we had to kind of change the flow and the intensity a little bit, because I mean, the original program that we developed was about 8 or 9 days, um,
Yeah.
just to kind of make sure that everybody has enough time. But obviously, that's not realistic. We can't get guys off for that amount of time continuously. So it was
Mm.
condensed to 5 days. There's a little bit pre-course study that has to happen to make sure that you've got the basics there. Um,
Yeah.
and I had a lot of input from my co-instructor Francis, which is a guy from the US, EMT qualified, TCCC, all of the nice stuff. Extremely experienced guy,
Yeah.
with deployments to Eastern Europe, South America, the Middle East, and we kind of sat together and try and make it as relevant to our guys here, but also internationally. Um,
Yeah.
you'll As we go through, like, you'll see there's a lot of equipment and skills that's a bit more than what's required by the South African scope to make
Yeah.
this internationally relevant. Obviously,
Yeah.
there's some guidelines on what you can and can't do in South Africa, um,
Yes.
but we're trying to make it as relevant to the international, what's the best practices now, and we took
Yeah.
from where we the best sources we can, to incorporate that with the newest curriculum in South Africa. Yeah.
Okay. Okay. Awesome. So you actually just brought on something. You touched on something now that's going to be a good question, especially for those listening who might not know the difference.
Okay.
So you mentioned something about how certain things that we can do in South Africa and certain things that we can't do in South Africa.
Yeah.
Could you touch on that? Because a lot of people who don't know much about the medical industry and don't know much about having done first aid or having working in a first aid environment, um, don't know too much about the legalities of how you can respond and what you can do. For example, I think recently they passed that a civilian can't apply a tourniquet in South Africa. I think that was recently.
No, that's
Um,
that's still very much a thing we can do.
oh, really?
Yeah. So with the tourniquet, there's a lot of back and forth on it over the last few years.
Yeah,
But the last I heard and what I'm aware of, um,
yeah,
it's actually now incorporated in uh, EMS teaching where it wasn't really a thing. So the last time I
yeah.
did my updates and refreshers, we actually had a bleeding control section where they touched on hemostatic agents, different types of tourniquets. So no, it is still a
Okay,
thing.
okay. Well,
But
that
there's
makes me
been
happy
there's been
because
some massive changes though in what we can and can't do. So
okay.
yeah,
So do you want to touch on that? So
yeah,
people listening can
right,
can 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 get an idea as to how different things are in our country.
yeah,
For example, like I was talking to you about the IT clamp,
yeah,
about wanting to order that and not being able to order that because of our country's
yeah,
laws and
yeah.
yeah,
So basically, medical devices has to go through an approval process for commercial distribution and use, basically in all countries. In South Africa, that's kind of mainly the Health Profession Council and their different bodies. In the US, it would be the FDA would be then needs to give a needs to give approval on whatever they want to use. So
Yep.
something like the IT clamp is a good example. For the guys that don't know, it's a type of bleeding control that kind of clamps the skin together, and it's got little spikes and it kind of locks in. So there is things that can and can't be used in that regard on devices. This the same with any medical device, like electronics, for example, needs to be approved by ICASA, and then it has to go through the clinical trials, and then it will only be approved for local distribution. You have to actually have a license to distribute medical equipment. That's coming out in the last few years. On protocol changes, I think the easiest is like the airway and breathing stuff for most of the guys.
Yep.
Recently, and this is something that's been fought quite vehemently now still, and it might get removed from the advanced first responder program, is the use
Yep.
of oxygen, supplemental oxygen.
Okay.
Where the Health Profession Council feels that it's too involved for the level of training, but a lot of the experts involved in the curriculum development feels that it's an appropriate skill to use. So
Yes.
that's something that I suspect they're going to remove it. They're very risk averse, so they might remove it. Currently, it's still in the curriculum, so we're still teaching it.
Okay.
For use for like breathing difficulty and CPR and that
Yeah.
type of thing. Other good example is the use of airway devices. You'll see
Yep.
in some of the media that we posted, we introduced the guys to the nasopharyngeal airways, the NPAs,
Yep.
as well as eye gels. Now, you see, sorry,
That,
sorry.
that,
All the duffels are still packed from the training, so I haven't packed anything away yet. So this is an eye gel device.
yep.
So this is definitely not on a South African scope. However,
Yep.
this is something that's been implemented in overseas markets. And because the program is a mix between local and international, because we have guys from Europe and the US and South Africa that's attending this, we kind of try and make it as universal as we can. So
Possible.
everybody gets introduced to this, everybody gets to practice the skill, but with the
Yep.
very clear caveat that you cannot use this in the South African scenario.
Yes.
And it's the same with the NPA, nasopharyngeal airway. It's safe, it's easy, and it's a very useful skill. However, on a first responder level, it's not a skill that's cleared or authorized. However, overseas and it is on certain levels. And
Yep.
especially in the tactical industry, it's a common used airway. So if you look at the Committee of Tactical Combat Casualty Care, their airway escalation is positioning, NPA. They've removed this as far as I understand, and they've skipped straight to a surgical airway.
Okay.
But in TECC, it is still part of that escalation. So as part of that escalation, we teach that. But with
Okay.
like, listen, you cannot use this here.
Yeah.
However,
Yeah.
across the border, that's it.
Yeah.
So legislatively, that's kind of where we are. So that comes to kind of the IFAC contents as well. You'll see guys with NPAs and chest decompression needles and in IFACs. Currently in South Africa, you can't even, you're not supposed to be able to buy chest decompression needles unless you're an ILS level provider or higher.
Yeah.
So it's not even supposed to be available to the general public. And it's
Yeah,
also
I
one
got
of
mine from Canada. I got
yeah
mine from a certain person who happens to live in Canada.
yeah. So I mean it's a common thing in IFACs as it's a standard there. Um,
Yeah.
but it's something that will get you in big trouble here. And to be honest with you, IFAC in general, like you know as well, is for your own use, or for someone to use it on you. And the
Yeah.
chances for you to have a licensed provider that can actually use it where you're on patrol is very, very slim. So, and
Yeah.
chances are the guy that responds that's qualified or licensed to do it, he will have one of those items. And that's the same for the MPAs. Now, personally, like this is my personal opinion, not the company's. Um, Something like an MPA is a brilliant device to have. Um, the benefits are marginal, um, but it does take it does take a bit of worry off when moving, especially on the longer moves,
Yeah.
on the evacuation phases. And that's just my personal thing. So I am a fan of them. I don't think it's one of those things where you'll kill a patient with, unless you
Yeah.
really bugger it up. Um,
Yeah.
so it's a fairly safe device and safe procedure, and it's easy to teach. Um, but just know that there's some legal considerations with using it.
Yes. So that kind of leads me on to another discussion. And again, I think this should be this will obviously be very personal and got nothing related to do with our companies.
Mm.
Um, in especially in our environments, where you, like you said, an IFAC is an individual item, individual first aid kit. When you're on patrol with someone and you're literally in the middle of nowhere and evac is maybe an hour and a half away, um, if a guy's got to use an item like an MPA tube on me or an IT clamp or something that's frowned upon, I'm going to tell him, hey man, go for it, use it.
Mm.
Like if I need it, give it to me. Like obviously, but I mean that opens up a whole legal issue. If I die, and whoever, I mean, luckily, I don't really leave many people behind for
Yeah,
for
no,
them
but
to,
but but you're right.
but
There's a
it
there's a
does
legal
it
implication to
opens
that
up
guy.
it opens up my colleague who attempted to save my life. It opens up him to a world of shit.
Yeah.
Um, Legally. I mean, I'm supposed even the hospital, if they notice that this has been used and it's been used incorrectly and it's led towards my death, it opens him up to a world
Yeah.
of problems.
Yeah.
So that's unfortunately something that I'm sure a lot of people would be on the fence about. But if I know that my colleague knows how to, or my teammate knows how to to operate properly with that item, he knows when we go out into the field that he's got my full permission to do so.
Yeah.
I'm not too sure what your thoughts on that are.
Yeah, I mean, like we used to work under this gentleman's agreement as well, where we all receive the same level of training and um like okay, ignore now my medical background and licensing and so on, but um when we started, when the TCCC stuff started being taught by these operators in South Africa, obviously guys were taught how to decompress chests and taught how to do NPAs, um, and I know of a few guys in your area that had saves with the kits that was provided and with the training and um, like full on dude sucking chest wound. The thing was chest seal was applied, chest was decompressed, 100% dude was saved. He was a rock
Yeah,
star. Um,
yeah.
so I know of cases where that has been successful. Uh,
Yeah.
but the problem is your
Are we
issue starts when
are
it's not
we
successful.
still recording? Sorry, man. Oh, yeah, we are recording now. Sorry.
Yeah,
Sorry.
yeah, yeah, yeah.
Sorry to interrupt
No,
you. Yeah,
no,
sorry,
no
man. You were
stress.
saying?
Um, so yeah, I mean, if it's successful and we can crack a beer afterwards, 100%. Just
Yeah,
know that there is a line where the Good Samaritan Act does not cover you anymore.
yeah,
Um, so once you start venturing into so far out of your scope that you're doing chest decompressions and airways and like
yeah,
you become liable. Like
yeah,
you can even be criminally liable to
yeah,
a point. So uh, like the guys that attend our like this is something always stress, like stick within your scope, stick with what's available, and we kind of make sure that the guys know, okay, this is legal in these areas, this is legal in where you work, this is legal in the US, this is legal in the UK. um
yeah,
Obviously, I mean, if it's Goma in DRC, guys are going to be a little less concerned with what's legal or not, but the the way we are right now, um, that is, we make sure. But one of the
yes,
reasons also why we teach this level of stuff is that you're aware what is the next step that is going to happen or what needs to happen to this guy, and
yeah,
it helps you prepare and kind of keep a patient in a condition where um, it'll make it easier for them to transition to that higher level of care going
yeah.
forward. Yeah. So if you know, okay,
And
listen, the airway needs to be done, and this is why we do it. Okay, but I don't have this. But what can I do to achieve the same goal that is within my capabilities? Oh, maybe I
yeah,
can position an airway, for example. If
yeah,
you understand what I'm saying. Um,
yeah,
I can't decompress the chest, but he's getting attention. Okay, maybe I can burp the chest seal, and this is how they taught us. Um,
yeah,
you get what I'm saying. Um,
yes,
but just that's why we make sure that the guys are saying this is what's legal in your environment. We show this, but we're not going to go into too much of that. We touch on it in the course quite extensively, um,
good.
but just be aware of that going forward.
Okay,
Yeah.
cool. So then, yeah, moving on, I think, going back to the course and everything. So once you had all of the content together, and you had an idea as how you were going to go ahead with teaching the course, what was the next step for you?
Um, in what regards specifically? Sorry, it's a quite
So,
a
for
it's a
example, I
broad
mean, you
question.
had you had the content,
Yeah.
you had an idea how you're going to go ahead with the course. What was um okay? So let me give more specifics to that. So you had the students,
Mm.
everyone who was signed up for the course. You knew what you were going to be teaching. You had all the content. Um, what was the next step in your thought process as to how you were going to proceed?
Yeah, I mean, for for us, the venue was quite important, and the equipment that was going to be used was quite important. Um, we wanted to. Uh, I mean, I don't have to put a ranger in a wilderness environment to kind of make them understand it because that's where they're working. Um, but specifically to make it relevant to their training environment, I can't put them in a classroom in Joburg and expect them how to teach a long distance evacuation on foot in a classroom in Sandton, for example. Um, so the training venue was quite critical for us. It had to be accessible uh, for guys or pretty central for everybody, which is difficult because I mean we had delegates or students from the Western Cape. We had guys from uh, the Lowveld up north, close to the Kruger National Park, and obviously we had guys that was flying in internationally. So it had to be within a reasonable distance of the airport for whoever was flying up and driving down, um,
Yeah,
I think we got a pretty decent venue, Rotsenbos, just outside of Brits. It's about 2 hours from the airport, or hour and a half, depending on traffic.
yeah,
And it offered us the bush environment. It's safe enough for students to not worry about stuff getting stolen. I know that sounds ridiculous, but it is a consideration,
Yeah.
and it offered us enough of environmental factors for us to make it as realistic to the environments that they'll be working in, but in an environment that's safe enough to learn. Um,
Yeah.
at that for the medical stuff is difficult enough for you not to be able to worry about, okay, I might get a contact or I might get run over by a herd of elephants. Um, so it offered an environment that's conducive to learning, but also the environmental stress is still there to make it realistic. Um,
Okay.
and so that was on the training venue. Uh,
Yeah.
on the equipment side, we wanted to introduce guys to as much of the new stuff as we can. Um, knowing, yes, you might not get access to all of it, but what if you get donated a bunch of SAM XT tourniquets instead of the softies that you always get? Um,
Yeah.
so like we have a bunch of like these blue trainers. Like this is a SAM. Um, here's a softie. We obviously have the cats. Um, and a few others. I mean, we had rats, tourniquets, like I don't, like yes, I know that they're not ideal, but we try and introduce you to as much of what's out there as possible,
Yeah.
not just what is TCCC recommended.
Yes.
Um, so that was a critical point for the training team. Um, and I mean that include different types of stretches, like you can see at the back here, the North American Rescue folding litter. We have a
Yeah.
skate, that plastic one that rolls up. We have you see at the bottom of my bag here, we've got one of those
Yeah.
rolled up uh, canvas ones,
Yes.
improvised litters, different types of bag valve masks. And so we want to introduce guys to as much of the latest equipment as well as the stuff that they'll get locally,
Yeah.
um, just to make it as relevant and as informative as what we can. Um,
Well, I think that that's very important because if you stick to a certain type of training, and you constantly give the same type of training to the same people over and over again, if they step into another environment where they are suddenly open to a different tourniquet or a
yeah.
different chest seal, um, or stretcher, for example, those silver, those aluminium stretchers
Yeah,
come apart,
the scoop
where you can
stretches.
slide, which are fairly awesome.
Yeah,
As
no,
soon as you
they're
open
gold
up
standard.
them up
Yeah.
to something a different style of applying first aid, they're going to stress out, and they're going
Yeah.
to stress out at the worst possible time when they're dealing with a
Yeah.
patient.
No,
Um,
100%. I mean, and one of the reasons why we also throw or expose them to this much equipment, um, is it helps you to improvise as well. Now, improvisation is not a plan, but
yeah,
if you know there's different ways of doing a certain job, you are more readily available, more easily able to make a plan with what you have, because you might recognize, okay, like I know this is just a piece of like mesh with poles in. Okay, maybe I can duplicate this somehow.
yes,
Or um, with the junctional, with the pelvic slings and the junctional tourniquets, because we've got the commercial ones, the SAMs, and there's another one now that I can't remember, that you kind of crank down, and it's got these rubber blocks that kind of push into your pelvis to kind of compress those arteries. So okay,
yeah,
I might not have that. Okay, but maybe I can use a belt and a water bottle and make a junctional tourniquet from that,
yes,
which they also practiced. Like that was also taught,
yeah,
on how to convert a SAM splint, those aluminum flexible splints with a tourniquet, make a pelvic sling from that, or a pelvic tourniquet from that, or use a
yeah,
belt, or use a sheet, or So we show them how to use the commercial stuff, um, and if they don't have that, how to make an alternative from that.
Yeah.
Um, just because
Yeah,
you
I think that's
know
incredibly
what you
important
might
because
do going forward.
when I mean, for example, that me leaving my work environment, heading onto a bus, and then from the bus onto the aeroplane, knowing that when I get onto the aeroplane, I can't carry my IFAC with me.
Yeah.
Being in Cape Town without my IFAC, I feel so naked.
Well, I mean, there's
But
you.
I know that if I get into a situation, I know that I'll be able to use my training to be able to improvise.
Yeah.
So that's why that method of training, what you did at that course, is so important.
Yeah. No, I mean, so we try and expose and prepare guys for as much of the environment that they might face. Um, and we know that guys don't stay with one company forever. Um, some guys do, but it's just not realistic enough. Guys move
Yeah,
from APU to other security factors, or they go overseas, or they might go work in Mozambique on one of those projects, or um, where there's different uh, equipment. And one of the best things is, and I love it when international guys donate equipment, uh, but guys don't might not have then the exposure on that equipment. Now there's a training issue that needs to be corrected.
yeah,
So that's why we give them as much diversity of kit that we can. Um,
yeah.
there was a there's something else now that I sorry man, I kind of lost my train of thought because I was looking at these 20Ks. Um, we actually had a chat about the 20Ks, the training with the softies versus the
Yes,
um
versus the
yeah.
cats.
So the general idea is the same, but it's the mechanics that might differ
Correct, yes.
on the physical how the thing works. So one of the ones that we don't have and we don't even bother with them is the mechanical ratchet types. Um,
Yeah,
it's just been shown as to um, in our environment specifically, it's just been shown not reliable with the dust and the um, being in the IFACs and and
yeah,
the elements. Yeah.
yeah. So I actually, talking about that, I actually saw a video. I'm not too sure. It was a reel on YouTube. They were going through the benefits of it, and they were showing it. So it's already strapped to the guy's legs,
Mm.
and he's going through a drill where he's being shot at, and
Ah, yeah,
he's
yeah, yeah.
firing back,
It's
and
it's
he
part of
gets
the
shot, and
holster thing.
yeah, and then
Yeah.
but no. So my whole thing is okay, cool. Understand the likelihood of it happening, but what happens if you're shot on that specific spot?
Yeah. I mean, nothing is
I mean, there
infallible.
goes the TQ out the window.
Yeah. I mean, there's a very interesting reel that I saw recently. Is a medic in the Ukraine where they say that their guys go out with a minimum of 3 to 4 20Ks per person,
Yeah,
and they usually run out. Uh, Now
yeah,
I do understand that the use case is different for us than it is for them. Uh, but these things fail. It's the same reason we
yeah,
carry spare magazines. It's a mechanical device. Things fail. Um,
yeah,
so you'll see in my bags like there's a little IFAC strapped to it. There's a tourniquet in there. There's a little cat in there. There's another softy on the inside. My fanny
yeah,
pack, I've got another one. Um,
yeah.
so I always make sure that I've got multiples um, of that. But then again, like I that's expected because I'm the I'm the bandage
Yeah,
cat.
well, exactly. I
Um,
mean, just going back to them talking about, being issued with a minimum of 3 to 4 tourniquets
mm,
in Ukraine. when I was doing my TCCC with that organization in Joburg,
Mm.
they showed us a video of some UN guys getting hit in contact, and one of the guys got hit by an IED, and I mean his legs, both legs gone, and one arm.
Yeah.
They ended up using 3 tourniquets on the guy.
Yeah, and I mean it doesn't even have to
So
be anything that dramatic.
that scenario is completely different, and it makes sense to have to carry more than
Yeah.
three
I mean,
tourniquets.
we've had it where a TLB, a guy falls off the tractor, the TLB drives over the guy's arm, um, and there you need two. We needed two on that guy, because one
Yeah.
just didn't, and that's just the tractor, man. That's not even an explosion. Um, so, um, so that's just kind of, sorry, just getting back to the question.
Yeah, sorry.
So, just kind of expose the guys to as much as um, different scenarios as we can, and getting those scenarios relevant to, like, it was a bit of a challenge because we had guys from the US as well as South Africa to try and keep scenarios relevant to both. Uh,
Yeah,
where on the one side they face explosive drones, on the other side they face elephants. So
yeah,
try and keep it interesting and relevant for both.
yeah.
Like there's lessons learned. Like we'll definitely work on some of the scenarios. But very good feedback from both sides. And um, one
Yeah,
of
so the
what
guys that I sent down, I had amazing feedback from them.
yeah, I mean,
Especially like from you as a trainer, I had amazing feedback.
awesome, thanks, man.
In general from the whole course, it was great feedback. Especially Rostenbosch
Mm.
camp. The place was, from
I
what I've
can't say
heard,
enough good things about
everything
that
was
venue.
well thought out. Everything was well planned. Yeah,
That
so that's the feedback that I've had.
that venue is legend. Like,
Yeah,
I'm quite familiar. Like there's a long story to that, but we absolutely love that venue. And we're definitely going to use them again for our future programs. It just offered us the facilities are comfortable enough for the guys to actually be able to relax after a long hot day. Because I mean, we were there in January. Like it is hot.
yeah.
I think the average was between 35 and 38 degrees. And I think the hottest they clocked close to 40. And we had some legend thunderstorms. Um,
Okay.
like on one of our scenario days where we do the low light section, um, we did like 3 hours driving around in vehicles doing patient scenarios in the vehicles, um, just because the storm was so bad. And like I said, I'm very familiar with that property, and I got lost at one stage because you just couldn't see 10 meters in front of you.
Oh
Um,
wow. Okay.
so nature delivered a level there where even as because we were two instructors, so we it actually challenged us as instructors as well, to kind of run the scenarios and navigate and keep everybody safe. Um,
Yeah.
and it just shows you how completely random and unpredictable Africa can be. Um,
Yes.
and
Well,
it
that's a good thing, especially for
oh
the
yeah,
scenarios, because I mean that's the type of scenario you could be facing.
yeah,
You're out on patrol, you get hit by an elephant, but you're also in the middle of a storm. It's pouring with rain.
mm,
You've got to be doing blood sweeps while it's pouring with rain on you, and while you're working on a guy, waiting for medevac.
yeah,
Um, in Africa, that's a reality.
yeah. No, absolutely. So the venue, I think we hit the home run with. Like we we very happy with that, and it offered us everything we wanted. We've got a second location, about an hour and a half
Oh,
north, which is much more rustic. Um,
okay.
and funny enough, with the heavy rains we had there, um, we left there a week later. The property was completely inaccessible. The river came up
Oh
about
wow.
3 or 4 meters, and it cut off the entire property from road access. So the guys that
Oh
was
geez.
on there
Okay.
were stuck there for a week and a half. They just couldn't get out of the property. So um, it and that's one of the reasons why this isn't your basic. There's a step after applying a tourniquet. Um,
Yeah.
and it just reiterated that, like, what is the what is your alternate contingency and emergency plans when it comes to evacuation? You might not get a road evacuation. And that's kind of where we want the thought process to go with this course. Yeah.
Yeah.
So
I kind of you touched on something which leads me to my next question. With the scenarios that you're running, what was your thought process when coming up with these scenarios? I know you mentioned obviously, some of these guys are dealing with explosive drones, and some of the guys are dealing with elephants, um, amongst other things. Obviously, what was um, how easy was it for you to come up with these scenarios? Because I know originally you didn't have access to a vehicle and you ended up using our vehicle,
yeah. So
I
uh,
think.
our our backup vehicle became unavailable because for most of the stuff we use 2 vehicles
Okay.
just of the group size. Um, so I've got an SUV that
Yeah.
we use for training. Then we had a pickup or a bucky that was going to be for um, because we wanted to introduce guys to patient care and evacuation inside an SUV style vehicle, as well as a open
Yep.
cab or an open bin pickup style vehicle. Um,
Yeah.
just because that is what they will have, but make it relevant to everybody because give them different vehicles to work from, how to set them up, how to load patients and work inside those vehicles. Um,
Yeah.
and just on the very last minute, the vehicle that we were going to use, that guy kind of had to get out of there. And luckily you guys stepped up, which actually worked out nice because that was an actual how the APU vehicles are actually set up with the cattle rails
Yes.
and it just offered a level of authenticity, which was great. Um,
Yes.
but with the scenarios, we try to keep the scenarios as relevant to Africa, like because it is an anti-poaching centered program. So we didn't
Yeah.
introduce like drones and all that type of stuff. Maybe maybe in a later stage, but for now, it was mainly focused on um, like a contact with poachers that they might get, or an animal incident, or a vehicle accident. Things that's relevant to that environment. Um,
Yeah.
and most of that can translate globally. It's not super. Okay, an elephant running over a dude, that's kind of a niche, but for the most part, the treatment of that is the same.
Yeah.
Which was pretty awesome having the Rangers integrating with the overseas guys, because you have that cross pollination of ideas and skills and experiences. So um, the South African guys kind of just by them being there and doing what they were trained to do, kind of exposed the US guys to a different way of doing things and
Yeah.
vice versa. Like the US guys that was here, all professionals in the industry, um, except I think two were professional adventurers, if you want to call them that. But
Yeah.
um, and their skill and expertise and training kind of filtered down, and they could see how the other one is doing it. And that's why I always say, like, I try and facilitate the learning for the most part,
Yeah.
not just teach two people, but let them learn and experience. And because I'm not going to know everything, and I
Yeah.
definitely learned some. There's some interesting things that we'll touch on, but like silly things that just makes things life easier. Like, why didn't I think
Yeah.
of that?
Yes.
Type of thing. So. Um, with regards to the specific scenarios, I kind of dug out what I've experienced over the last 15 years. Um,
Okay.
Patients that I've seen, guys that I've treated, um, and the same with my co-instructor. He brought in what his experience has been, and we kind of meshed these scenarios together. Um, and then that's the field scenarios. We've got the paper scenarios to kind of practice specific thought processes and so on, but the field scenarios is kind of that's how we kind of went with that. Yeah.
Yeah. Okay. Okay, good. And then in terms of um, kind of staying on the subject, the guys from the US and guys from South Africa, what do you think what was their reaction when kind of exchanging stories? Um, do you feel like the guys, because I know a lot of guys from the US have this, like we've spoken about, this romanticized idea about what anti-poaching is. But the same could be said for South Africans, especially who are in the anti-poaching industry, who might look at guys who have served all over, whether they've served in Iraq, Afghanistan, Ukraine. They also might have a romanticized, which to a certain extent is probably not romanticized. But so what were their reactions? Did they share stories? Um,
Yeah. I mean, there was some super interesting conversations that happened in the classroom environment.
yeah.
Um,
Obviously, I don't want you to go into specifics about the
yeah,
stories,
yeah.
but
I
I'm just
mean,
interested in how how the conversations went.
yeah. I mean, the guys that was there on both sides, operationally were very experienced. The South African and the US guys. So the body armor conversation, for example, like that's a pretty generic conversation that came up, and surprisingly, the same kind of thought process was applied across the board, when the discussion happened, which was interesting to for me to kind of see how they kind of think similarly on these things, where it's um, what I think wowed some of the guys might have been the fact the added element of the animals. That's an operational consideration for our guys, or for the APU guys, um, which is pretty interesting. Another interesting conversation that was had was the use of technology, drones, that type of thing. Um, which is something that is very much in its infancy still in South Africa,
Yeah,
compared to the rest of the world. Like,
yeah,
we've been using it for a while, but not at the level that it's being used or utilized overseas. Um,
yeah,
so there was a very, very interesting exchange of ideas and knowledge when it came to these types of things. Yeah.
yeah. Okay, awesome. That's good. Um, yeah, and just in terms of how the rest of the course, how everything started to gel, and how people worked with each other. Can you take me through kind of like the last couple of days of the course,
Yeah.
in terms of the exams, and the practicals?
Yeah. So the 5 days are structured pretty standard, where your first couple of days are very theory heavy. Because
Yeah,
like I said, this isn't um a shoot and tourniquet type of course. That's not what this is. Um, there is elements to that, but it has to go further than that. So, a lot more attention is being spent on anatomy and kind of the theory behind why we do what we do. Like, as you can see, I mean, this isn't a, a little pamphlet. Like, there's
no,
there's some there's some reading involved. Um,
yeah,
so so the first couple of days, like especially day 1 and 2, quite heavy on that. Towards the end of day 2, we start implementing more practical skills. Day 3, um, a little bit more outside, where I can't remember if it was day 3 where we had the what we call the appreciation drill, the ranger
Okay.
appreciation drill. Um,
Okay.
we won't go into too much detail, but it's a long walk,
Okay.
a long
Okay.
walk with equipment and patience, and um,
Okay. I like that.
yeah. Um, so there you start putting things together a bit more, and environmental considerations are being brought in, and so on. Day 4, then obviously I'm not going to go into too much detail, but um, that's where we start drilling scenarios, the paper scenarios, where the skill stations, where the guys actually have to kind of start working on skills, trying to get that stuff as smooth as possible. Um,
Yeah.
with a culminating exercise then at the end of day 4, and then testing is on the morning of day 5. So
Okay.
the guys actually write an exam. Um, like you can actually like if your guys probably told you it's a bit of a it's a bit of a paper. Um,
Yeah.
so
No,
but
they did tell me, yeah.
yeah, and I mean like they don't even see the whole portfolio because um we'll compile a portfolio of evidence with all the practical notes and all of those things marked in there, and then the paper section is then what they then write and we file.
Yeah.
So this is definitely a pass, not pass course. This isn't a you pitch up and you get a certificate course. This is definitely not one of those. Um,
Yeah.
there's a you definitely have to prove that you are capable in the skills, in the decision making, and in the theoretical knowledge, um, for us to issue you that certificate. Um,
Okay.
and yeah, I mean, so that's kind of the broad outline. The days are long, like um, the days start fairly early. Um,
Yeah.
where you usually like an 8 o'clock start, lunch at around 12, 1-ish. Um, between 5 and 6, the day will end with the instructional period. Um,
Yeah.
however, we do leave the center open, or the everybody still has access for a few hours afterwards to practice on the skills. We've got the full body trauma mannequins, we've got the airway mannequins, and the CPR dummies, and the all
Okay.
of those
That's
equipment
awesome.
is still there for the guys to go after hours and still train, and they still have access to the instructors up until about 7, 8 o'clock at night. Um, and then the same in the mornings before. Uh, I mean, we were down at the training venue from about 6 or 7 in the morning, um, and we had guys in there already training and reading and prepping, and which was amazing to see. Like
Yeah.
the guys were really taking advantage of that access, and it showed. It showed at the end of the program.
Yeah, well, I mean, you mentioned to me, I remember we were chatting during the course, and you told me that all my guys were spending hours at the workstation. Now I was really happy to hear that because I know especially one person, she's been wanting to do this for a long time now.
Yeah,
So I was very happy to hear
yeah.
how much effort she was putting in, and
Yeah, I mean, and it
yeah,
and it, and it showed from day one, and the types of questions that was asked, and that's what we want. We want that involvement, and that development. We know this isn't a skill that's very that doesn't get a lot of attention, especially at this level, and
yeah,
it's not for everybody. Like I have to say that,
yeah,
like not everybody's going to do the advanced responder type training. Um,
yeah,
but we want to put as many people as we can through it, regardless.
yeah.
Yeah.
And then my next question was going forward. Obviously, so this was an introduction.
Yeah.
So it was as far as please correct me with my
Mm.
wording. It you kind of uh, made it more condensed. Is that correct?
Yeah.
So going forward, it's gonna be longer.
So we actually decided to keep it at this time frame. I think this is the most this is the best kind of time frame that people can get off and let guys, because this is your senior team members that will be attending something like this, and you can't really release your supervisors and your managers for more than really 5 days. To be honest, like
Yeah.
administratively, that's gonna be difficult for folks. What we are gonna do though going forward is we'll have a I want to almost say a provider level one after this. Um,
Okay.
that's a bit more um, intensive. Uh, how can I say this?
Would that
Tactically
be
and
kind of
and and, and medically.
like during the golden hour,
Yeah,
um,
so
uh,
so
prolonged field care?
there we go. The prolonged care stuff, a little bit more in detail in that. So
Yeah.